And Texas Governor Greg Abbott joins me now live. Thank you for speaking with me today, Governor.
My pleasure. Thank you, Stephanie.
The Texas Tribune reported that you were planning to announce as soon as Friday about reopening a wide range of Texas businesses, including restaurants, hair salons, and retail outlets. What can you tell us preliminarily?
Sure. Actually, it will be on Monday when those announcements are made. It will be an updated executive order. If you go back in time, I issued an executive order that goes through April the 30th. And so I need to update that as well as explain where we go from here. The fact is, Texas has done such a good job to slow the spread of the coronavirus, and working with a team of doctors who are providing the best advice for a safe pathway of opening businesses, we intend to announce some businesses that are able to open and the extent to which they are able to open so that we can get businesses back up and running and get employees return to their jobs and earning a paycheck.
And of course, it is important to get businesses open, but a lot of Americans are saying that they are not comfortable with reopening the country at this point. So what have you been learning from medical advisors to open these businesses in a safe manner?
Sure. Two key points, and that is, even though we will be gradually opening up some businesses and doing so in a safe way, there's no requirement that anybody go and open their business or return to work. We do want to provide, if you would, the legal ability to do so. We are basing this on doctors' decisions. I have a team of doctors advising me. One is the former head of the United States FDA, Food and Drug Administration, former head of Medicaid, Medicare. We have a doctor in charge of COVID tracing and tracking who is advising us on ways that we can monitor exactly what is going on as we do gradually open up businesses. This is a plan that was presented to the advisors that the president is using, and they've cleared this. They said this is a solid plan to be used, and so this is going to be a very safe way to go about gradually opening up businesses while we monitor whether or not there is any increase in the coronavirus in Texas.
So can you give us an idea of how this is going to happen? Because a lot of medical experts say it requires lots of testing, and it also requires social distancing as well as people wearing masks. So are those things that we are going to hear from you?
So the medical experts that we are using talk about those very strategies. The testing and the monitoring will be going on. The safe distancing strategies are still required. Face masks are always encouraged at this particular time. I'm not sure if that will be a state mandate, but certainly is a practice that would be encouraged.
So how can you guarantee the safety of Texans if face masks are not required, or if there is not enough testing being done? How come there isn't going to be a standard that maybe everybody get testing or everybody wear a face mask?
Well, what will be done, there will be a ramp up in the testing that will be done. The type of testing done for strategies like this is what we call community-based or community-wide testing. It won't be testing every single person that comes in, but it will be a monitoring of the entire community. Some people will be tested who do have COVID-19 and show the symptoms of it. Some testing will be done at random of people around the community. It gives us a great feel for who may have been exposed to the COVID-19 virus. One thing that we're learning from both New York and California as they test wide-based people in the community, they found out that the number of people who actually have had COVID-19 are far larger than what they thought existed. What that means is it could be true in El Paso as well as elsewhere in the state of Texas. There are a lot of people who actually had COVID-19 and have immunities from it as a result.
So we saw that while you reopened state parks, the two parks in El Paso, Franklin Mountains and Waco Tanks, did not reopen. In fact, they're still closed. So will we see the same thing happen with the reopening of businesses where they open in certain counties and municipalities depending on the rate of COVID-19 infections?
Right. We have to maintain a level of flexibility based upon various factors. One factor will be whether or not there is a particular county or region where there continues to be an increase in COVID cases. It could be some rural counties where there are no cases of COVID. It could be dependent upon hospital capacity. One thing that is essential is that wherever we open up, that there must be no dramatic spike in the number of coronavirus cases, and there must always be plenty of hospital capacity so that anybody who contracts COVID-19 will be able to go to a hospital if they need to. But remember this fact, and that is only about 10% of the people who actually contract COVID-19 actually need to go to a hospital. Most people are able to fully recover without having to seek health care. In fact, get this, Texas ranks second in the United States in the number of people who have recovered from COVID-19.
All right, Governor, thank you so much for your time. We appreciate it.
Sure, thank you.